My name is Delaney Mortimore, and I'm a junior studying human services. Today, I'll be discussing period poverty. I'd like to begin today by establishing that menstrual rights is an intersectional issue. Not all menstruators are women, and not all women menstruate. Period poverty can impact anyone, but it's important to acknowledge that there are certainly factors such as race, socioeconomic status, gender identity, incarceration, age, disability, and a plethora of others that impact our menstrual experience. My entire life as a menstruator, I've been very aware of the unfair stigma surrounding this biological process that no one chose to experience, but it wasn't until joining the Period Project that I realized how deep the stigma truly runs and how severely it impacts so many people on a daily basis. The Period Project was founded by the amazing Allison Ricker in 2018, and I've had the honor of serving as the Director of Public Relations for over a year. The Period Project works to break down barriers associated with menstruation through education, donation, and advocacy. We also work to incorporate inclusivity and intersectionality within the menstrual movement. Over the last 2 years, we've donated thousands of products to shelters in the community, hosted dozens of educational events, and even helped get Purdue to provide free products across campus. This semester specifically, we've been working to promote sustainable menstruation and intersectionality within our club. Through this work, one thing has been made abundantly clear: period poverty is everywhere. According to the American Medical Women's Association, period poverty refers to the inadequate access to menstrual hygiene tools and educations, including but not limited to sanitary products, washing facilities, and waste management. In other words, period poverty can impact anyone. There are very little statistics about period poverty due to stigma and lack of awareness, but we do know that menstrual products cannot be purchased with SNAP, Medicaid, or health insurance spending accounts. 30 states still have a luxury tax on menstrual products. Fun fact, Indiana has a luxury tax on tampons, but not on barbecue sunflower seeds. So we see where the priority lies here. Statistics on non-women menstruators are lacking, but we do know that roughly 500 million menstruators are impacted by period poverty globally. In our developed nation, about 11 million women in the US are living below the poverty line, many of whom are forced to choose between menstrual products and food, a decision no one should have to make. Are periods really that expensive? Let's break it down. The average menstruator has their period from 3 to 7 days from the ages of 13 to 51. This means an average of about 456 periods over the course of 38 years of your life. This equates to about 6.25 years of your life spent menstruating. One tampon lasts about 6 hours, so you'll need roughly 4 per day. For a 5-day-long period, this is about 20 tampons per cycle. 20 tampons times 456 cycles in your lifetime equals 9,120 tampons you'll need throughout your life. For the average box of tampons, there are 36 in it, so we'll need 253.3 boxes in your lifetime. At $7 each, you'd spend $1,773.33 on just the bare minimum of tampons in your lifetime. Nearly $2,000 just for being born with a period is wild as is, but this fails to take into account other aspects of dignified and sanitary menstruation, like pads, panty liners, toilet paper, running water, clean underwear, pain medication, birth control, and many, many others that we often take for granted. One of the places hit the most with period poverty is our jails and prison. According to a study conducted by the Correctional Association of New York, in 2015, about 54% of menstruators in New York prisons had insufficient period supplies, and the access they did have did not meet their needs. Inmates have claimed to use the same pad for days on end, and the ones they did have were not absorbent and did not stick. In 2017, women in federal prisons were granted free tampons, pads, and panty liners. Although this is an amazing step, this law has not been passed for state and local jails and prisons, nor does it safely guarantee non-women menstruators access to the products they need, putting them in an unsafe situation when they need to ask for them. Another group severely impacted by period poverty is homeless menstruators. As discussed previously, SNAP and Medicaid do not cover menstrual products, and shelters rely solely on donations. Pads and tampons are one of the least donated items, so shelters have to ration them out, causing people to use toilet paper, cardboard, socks, or trash to absorb their blood. The shelters that do provide products are often women's shelters, leaving out transgender and non-binary menstruators. Violence against the transgender community is rampant as is, so putting them in a position to out themselves when in need of products is an extreme safety hazard, especially when facing homelessness as well. It's fairly easy to see that other countries and Americans who are homeless, incarcerated, or impoverished face period poverty, but what about the people we know? ACE Food Pantry is an amazing resource on campus that works to provide students with what they need. ACE is constantly in need of period products and has expressed to us how much stigma they've noticed surrounding the topic of menstruation. It's easy to be blinded by the extreme privilege on our campus, but we cannot forget about those who need a little bit of help. My leadership position in the Period Project has opened my eyes to how many have been forgotten within the shadow that stigma casts. Providing free emergency products on campus is a huge step, but it simply is not enough. The support we've received for our efforts is so encouraging, but the backlash opened my eyes to how much still needs to be done to tackle the stigma. Period products are not a luxury, and I can assure you that menstruating is not a choice. Products are just as essential as toilet paper and should one day be free to all, and especially not taxed as a luxury. The menstrual movement has shown me that change comes to those who work for it. Issues that primarily impact women and marginalized groups will be brushed under the rug until we demand change ourselves. This can be seen both on our campus and with the 2 women on the West Lafayette City Council who are sponsoring a free product resolution in public city bathrooms. We can see with many movements that once someone speaks up, a ripple effect of activism, accountability, and change occurs. Purdue providing free products has ignited conversations everywhere. Shout out to the students at West Lafayette High School for demanding products. Period poverty is going to take a lot to eradicate, but there are ways you can help. Donate to ACE, local shelters, or reach out to the Period Project. Educate others about menstruation as the natural and normal process that it is, and most of all, discuss the stigma so that no more menstruators feel the need to hide their tampons up their sleeve or go without the products they need.